Okay, well, good afternoon, everyone. My name is Micah Kinder, and I'm the founder and CEO of Diabetes Now, and I'm really nervous because it's something I'm really passionate about. We are structured as an S corp, formed in 2019. We are a woman-owned business, currently pre-revenue, but do hold a pharmacy permit for the state of Arizona. And today we're going to talk about patient-driven diabetes care. Jesse Lutkin, age 32, Jada Lewis, age 24, and Tavia Warsham, age 21, Alan Hood, age 20. What do all of these people have in common? They died in 1 month from not having access to insulin or healthcare. To quote Jada's sister, she had to make the decision whether to pay rent or buy insulin, and that's not a choice anyone should have to make. This is my friend Lisa with her children Aiden and Lane. Aiden was diagnosed as a type 1 diabetic 7 years ago at the age of 8. His insulin is more than my mortgage. To quote Lisa, these tiny little bottles are the reason I work 3 jobs. Time away from my children is the price I pay to keep one of them alive. And she's not alone. 1 in 10 Americans have diabetes. I'm sure you know someone that has it. Over 8 million people in the United States struggle to afford insulin, other diabetes-related prescriptions, or health care for themselves or their child. And that was before over 12 million people lost their health insurance last year. According to the CDC, the average cost of diabetes is $13,700 a year. Could you afford that? These families have had to make choices between medication or healthcare and utilities, housing, and even food. The problem is that patients don't qualify for Medicaid, can't afford health insurance, or have a high deductible. The consequences of that are that people are ignoring medical protocol due to cost, and people are dying. The solution is Diabetes Now. We talked to hundreds of patients to find out what they needed most. They needed a community with access to healthcare for everyday issues such as diet and exercise, and blood sugar that will not go down, all the way up to serious issues and prescription changes. They also needed less expensive prescription drugs, lab work, and medical devices such as constant glucose monitors, insulin pumps, and at-home EKGs. We offer a wholesale pricing on medication for $20 per month. That's one of our memberships. We have a registered nurse helpline, all of our nurses being certified diabetes educators for $29 a month, up to 2 visits with an endocrinologist for $100 a month, as well as discounted lab work and medical devices. We have 5 streams of revenue, with the RX memberships coming in at 36%, the RN memberships at 34%, the physician memberships at 18%, medical devices at 10%, and lab fees at around 2%. Our market size, total available market, is just under 36 million people. SAM is sitting at just under 1.8, with SOM sitting at just over 190,000 people. Customer acquisition costs are $27.82, but will drop to $14.31 by the end of year 3. With a lifetime customer value for type 1 diabetic at $472,000. Type 2 is just over $700,000 because they typically, 90% of them have 5 or more prescriptions. Revenue for year 1, we're looking to net just over 1.7. Year 2 is a little over 11 million, and year 3 is just under 29. What that breaks down to as far as the different memberships, you can see them per year with a little over 8,600 memberships for the prescriptions, which breaks down to 720 per month, and so on and so forth through year 2 and year 3. Startup expenses and prize money, about 5,500 of that would be going for pharmacy and telemed software to have pharmacies not cheap, branding and marketing, and 2,100 for 3 months of a specialty answering service where it's all pharmacists. We have bootstrapped everything up until this point, but a cash infusion is really necessary to cover those initial expenses. Our key metrics are churn rate. Churn rate we expect to get from 3% down to 2%, which is the industry standard, with a 6-month expansion plan into Nevada, Utah, Colorado, New Mexico, and California, 12 months into Oregon, Idaho, Wyoming, Nebraska, and Texas. Our ideal customers are women between the ages of 36 and 52 and are themselves a diabetes patient or caregiver. Marketing strategy, we're partnering with a bunch of different people, strategic partnerships with the ADA, JDRF, and specifically Access Meds, which currently serves over 500,000 patients in the state of Arizona. We have a world-class staff and advisors, including Eric Smith, Aaron Eden, and Stephen Woods. Our timeline is opening April 1st for the community, the helpline the 15th, telemed May 1st, and the pharmacy on June 1st. Thank you so much.